Hi, ladies. So my friends from Mercy joining us again as the Victory Center and Mercy Health partner consistently on helping to provide excellent care for cancer patients here in Northwest Ohio, Southeast Michigan. And we're joined today by Kelly Martinez. Kelly, you've been with Mercy for, is it over 30 years?
31 years. It'll be 32 at the end of this year.
Amazing, amazing. And you've bounced around a little bit, but today we're going to focus specifically on neck and head cancer awareness month. Tell us a little bit about your experience so far with patients who are going through that form of treatment.
Sure. So when I started in oncology, when I left the inpatient, I started as the radiation nurse. So, and at that time we did not have Oncology Navigator. So by default, I was kind of the head and neck navigator for my patients. And I found out very quickly, two things I found out. Number one, I think people were afraid to talk about side effects because they didn't want people to think, worry about it. And I found out that was a myth. People needed to know what was coming down the pike and what they were going to be going through. And number two, I found out when you get diagnosed, people are in a hurry to get into treatment. I would be too. But with head and neck, there are things that have to be done before you can even get into treatment. And I started trying to figure out how to get rid of those barriers to care. And since I've been in oncology, I've now moved on to become an oncology nurse navigator, and head and neck is one of the populations I navigate for.
So let's describe that for folks who aren't familiar. There are some things that are included. There are some things that are not. You see just about everyone, but what would we define as head and neck cancers?
So somebody maybe that came in with the nasal pharynx, like a nasal tumor, tonsil cancer, base of tongue, somebody that, oral cavity, you go into your dentist, they're always looking for that stuff, after you've had your x-rays done, somebody laryngeal in your throat. Those are the types of head and neck cancers I'm talking about.
Well, that actually leads me really well into the next question. So even when I may not notice something growing, developing, some of the professionals in our lives are looking for those things already.
Mm-hmm. Yep. Number one is my dentist. Every time I go in, I go in twice a year, and that annual one is when the dentist will come in, and after they've done the x-rays and he's reviewed them, the whole thing, stick your tongue out, they put the gauze in, look above, look down, they're feeling your nodes in your neck. Yeah, a dentist is a really good one to be watching for any type of head and neck cancers.
Wow. Do you have relationships then with local dentists who are passing along people who say, oh, you know what, take a look at this?
Well, I'll tell you what, the relationship I have is with the Dental Center of Northwest Ohio, because one of the things that I'm sure we're going to get into is one of the biggest barriers to care for a head and neck patient is if they're going to have any radiation, they have got to have dental clearance. And that is because radiation could cause some long-term effects. And if you have any teeth that are bad and need to come out, those need to come out before radiation, because even years later, if you're extracting, you can have some big time problems with something called osteonecrosis, with the bones not going to heal. So a lot of times patients will come in and, dental insurance, either you have it or you don't. And if you have it, it's usually you're underinsured with it. And for a private dentist to get into, it's very hard. And we have worked really hard here at Mercy to collaborate with the Dental Center of Northwest Ohio. And those are who I work with when I have to get people in to have their teeth looked at.
Yeah, Lori, you guys are always collaborating across the community, and I think that's so special. Mercy Health is always talking about partnering with people for this and making sure that the relationships for that are strong. It's really important to make sure that we're all working towards the same goal.
Yeah, it's a team effort for sure. A lot of us in this community share the same mission when it comes to patient care, to cancer care. So to align with all of our resources together, I think it's really important. I think it is what enables us to deliver the same care in Northwest Ohio that people think you often have to leave this area to go find. But the collaboration is a really important element of patient care.
Yeah, well said. Excellent care exists here at home for a lot of folks. And that's really a great point to make. So Kelly, let's talk about this risk factors, things that people should be looking for, or maybe things that they can avoid and stop with their doctor's help that can potentially lead towards head and neck cancers developing.
So definitely smoking is a risk factor. Alcohol use is a risk factor. Now we know more and more about the HPV virus. A lot of people associate that with cervical cancer, but that can be associated with rectal cancer, head and neck cancers. And I recently, just last week, did a CEU, 1 hour CEU program with the Head and Neck Cancer Alliance that is talking how we're actually starting to see more head and neck cancers that are HPV related and less with the smoking, because I think, we're really working hard now to help people with smoking cessation. So those are some of the main risk factors.
Yeah, if someone is a smoker, they can see their doctor for some tips and tricks and ways to quit.
Yes, and we actually have a really well-oiled machine with a smoking cessation program here at Mercy. I know for sure we have 2 pharmacists over at St. Anne's that have actually went through some really good training, and they can actually prescribe when it comes to maybe Shantex or Nicoderm patches. They see these patients. And, one thing I would say to people, I talked to Heather, who's one of the pharmacists, and she said something to me the other day. I think right away what I say to people, oh, you've got cancer. Do you want to quit smoking? Are you ready to quit? Maybe, are you ready to cut down? Can we start there? We're willing to help. Let's try to make some changes that way.
Mm-hmm.
I think people often think, oh, well, what's the point in quitting? I already have cancer. But there are so many benefits to reducing your tobacco use, at least if you're not able to quit. That's completely understandable. You're going through the most stressful time of your life, so it could be difficult to cut a crutch habit like that. But there are so many benefits to reducing your smoking, just it improves outcomes, it improves the efficacy of treatment, and outcomes are better. So we do have support in place to help people quit smoking.
Yeah, and I think that's a great message to folks, that we don't want to strip you of your vices and your comforts and your creature habits and things like that. But you guys are so great at making sure that you're also supporting the awareness factor of things so that you can cut down, hopefully, the diagnoses of these things in the future, There are some differences in terms of gender and age with head and neck cancers, twice as common in men and a lot more frequently diagnosed in folks over the age of 50. Is that right, Kelly?
Yeah, that seems to be, I would say that, yes.
Is that circumstantial? Is that something that's environmental, or we're just seeing more guys over 50 who are smokers on a regular basis?
Well, I think too, another thing to mention is occupational hazards too. You know what I mean? And maybe some of the jobs that some of the men have versus the women, and occupational exposures like wood dust, and so maybe that could have something to do with it too.
Oh wow, yeah, absolutely. So what
I also think it's important to mention when it comes to cancer types that have risk factors like alcohol consumption or smoking. No one deserves cancer. Nobody deserves cancer. Even if you were a smoker or a drinker or still are. Our care team and our nurses like Kelly know, they create a judgment-free zone where they're there to treat you, every single person the same, regardless of your lifestyle habits or any choices you've made. We all have vices. It just happens that some of those, can increase your risk of developing cancer. And then other vices are, just as, they're more benign, so to speak. But that still doesn't mean that we don't each have our vices. So I would hope that if anyone is a smoker or drinker and they want help with quitting smoking, or they have hesitancy to get an oral cancer or any type of cancer screening, or if they have hesitancy to come forward and talk about their condition or symptoms or anything, that they would know that everyone deserves access to quality care and there's no judgment in whatever led to your risk factor for developing cancer or any other disease.
Yeah, Lori, I'm so glad you said that. We do have people who come in and they've been running their whole lives, or they're really hyper-focused on nutrition and diet. And they say things like, this doesn't make sense. I did everything right. Mm-hmm. And no one deserves cancer, regardless of what those habits are on a daily basis. So mm-hmm. I'm really glad you said that. How are head and neck cancers treated, Kelly?
Well, there's multiple things that could be happening. Somebody might come in an early stage 1 laryngeal throat cancer that could be just radiation alone. Some people come in and they might need combined chemoradiation, or maybe it's surgery that they need to have. And so again, timing's everything, especially if it's something where we're like, okay, this might be a total laryngectomy with a neck dissection. That's not done here. And we're sending them out, OSU, Henry Ford, Cleveland Clinic. So to get that referral and get them in to see the surgeon to get their input. Or like I said, if it's going to be radiation, first thing I have to do is get that dental exam, get the x-rays done. Then you don't just start, you got to come in after, let's say somebody has to have all their teeth pulled. And believe it or not, many people have to have all their teeth pulled. And I don't, that's huge. That's a quality of life thing. That's a shocking thing for a lot of people. And once all those teeth are pulled, you've got to wait at least a week or two to let the swelling go down before you can even have a radiation planning. If it's something where you need to do combined chemoradiation, you're going to need a port placed. There's a lot that's going to be going on, and they're going to be accessing your port. So lots of things that we have to really be working with in a timely manner. And that's where, as a navigator, that's probably one of the best things in my job, knowing that I can keep that on track and keep that moving along.
I love that title. In the time that I've been working at the Victory Center and learning more about services offered and treatment types and things like that, I really, really latch on to that title of nurse navigator, because that's really what you're doing. There is this crazy world of things that is completely new to an individual, to a family, to their caregivers, and you're helping them navigate that world. Yeah. So when we're talking,
Kelly does it really well. We jokingly, lovingly call her the pit bull. Because she fights for her patients. She'll do whatever it takes to get them in where they need to be and advocate for them. So it's awesome what navigation is.
We definitely collaborate, like we were talking about earlier. But one thing I learned, I always hear my grandma say, you'll get more bees with honey, please and thank you go a long way. I started working with offices, and maybe I wasn't getting that back, but I would just, when I could show them what I could do, and what that in turn helped is I networked, and I know a lot of people. I know the ENT offices. I know, there's a navigator up at Henry Ford. I know the surgeons at Cleveland Clinic. So not only am I an inside person for you when you come here to Mercy, I'm an inside person for those other offices to help expedite.
Beautiful. Really awesome, Kelly. At the Victory Center, we offer, when someone's going through this new diagnosis, we offer 3 free counseling sessions to an individual, a group, a family who want to talk through what they're dealing with. And I think that's definitely an important part of the process. But we also offer lymphedema classes and education on lymphedema, which can be a big side effect of someone who's going through treatment for head and neck cancer. Can you talk a little bit about that?
Absolutely. In fact, here we actually at Mercy, we have a PT oncology rehab, and we also have lymphedema specialists, and everybody meets with the speech therapist too when they start out, and they're given head and neck exercises to do when they're going to start with treatment. And they also typically, Dr. Patel, radiation doctor, will send them both to onc rehab and lymphedema. But it's a big thing. People, think of the old days when a woman had a mastectomy and they took a lot of nodes out, and you'd have that big arm. People, you say lymphedema, they remember that. They're not thinking of the lymph system in the neck. And then, it may not happen right away, but it might be, a month down the road. And they're like, why do I have a turkey neck? Why is it, it's the swelling. And there's things that they can do, like you said, your lymphedema specialist, ours here, that will teach them. There's ways to massage that, drain it. And that's a lifelong thing, people really need to know about. And I think when they come in and they're signing that consent, and you're talking about the acute things that are going to happen, and then you're going down talking about the long-term side effects, people really aren't focusing on that, because right now they just want to get through treatment and live. Now you're at that stage where they've made it, they're surviving, and they've got these quality of life issues. So
I'm glad the Victory Center and Mercy Health Oncology Rehab program are in place, because like you said, Kelly, people are worried, they're focused on their cancer treatment and making it through and whatnot, but they don't necessarily think ahead to on the other side of it, that they could be facing lifelong issues if other people didn't have their back and weren't thinking about those long-term and late effects of treatment.
That's the thing. I mean, when you're busy thinking about everything that's happening right now, you can reach your limit. And how do you even cope with these long-term things? How do you navigate them, Kelly? So I think there's something really special about that, because radiation can cause a loss of taste and smell. You can have these lymphedema issues. Maybe eating isn't comfortable anymore, and you've got to talk about nutrition and diet in the future. So when you're looking at these long-term results of someone who goes through really any form of treatment, what does that long-term rehab look like? And how do we help that person moving forward?
Yeah, we do have something here at Mercy called this, we have a Mercy Health Cancer Center Survivorship Clinic that's run by Amanda Dove, our nurse practitioner.
Mm-hmm.
But with a head and neck patient, we find they have got to, first of all, get through those symptoms. Just because radiation stopped doesn't mean the effects of radiation have stopped. So it could take people a good month to really start feeling like, okay, I'm starting to get my taste back. The dry mouth, not so much. That could be a lifelong thing. Maybe you have somebody, even though they've tried to do their exercise and swallow, they're still dependent on that PEG. And so we have to work with that and try to get them to eat and cut down on the PEG tube feedings. Like you said, the lymphedema that they have, and it's a pretty traumatic experience. And I think just to digest what they went through. So typically with a head and neck patient, we'll let them get through that recovery period. We'll get repeat scans. Then when the scans are good, that's a really good time to hand off to Amanda. Then she's going to sit down. She's going to go over those long-term side effects again, things that could happen, what to watch for, what to do. And, even if I get to a point with my patient where I know it's time to end navigation, we've got through treatment, we've got to survivorship. I always say to my patients, once your navigator, always your navigator. If you need anything in the future, you can call me. So, they need to know that you're there.
You got a big family.
She means it.
Yeah. Well, that is so much information for folks to absorb. I think the cancer journey is for everyone. But even more importantly, Kelly, you've done an amazing job, I think, of connecting with your patients. So before I let you go, I am going to link below this video to the survivorship video that we did with Amanda a little while back at Mercy Health, so that people can connect the dots if they have long-term plans and they want to see more about what that survivorship program is like at Mercy. But Kelly, tell me through, your biggest takeaway from all of this, working with patients and having 31 years experience. What's the biggest takeaway for you?
Oh, I have to say that the move from critical care inpatient to outpatient oncology, number one, was a big move for me, and it was a big change. But remembering something that stuck in my head with a nurse that was working in oncology at the time that I knew, that said to me, Kelly, the oncology patient, they have a spirit like no other. They want to live, they want that help. They're grateful for anything that you can do for them. And that is 100% true. And to know that I can be with these patients, and to know that, I'm going to walk them through, they know they can count on me. I'm going to be there. It's amazing. It's fulfilling. It's an amazing job. I love my job.
Kelly's really good at her job. I love, not only does she navigate patients through that initial diagnosis and through treatment and whatnot, but she connects them to important resources in the community like the Victory Center. And, we do believe that, the whole treating the patient, mind, body, and spirit, that spirit portion, the support from the Victory Center, that's such an integral part of treatment. Cancer treatment is not just chemo and radiation and surgery. That support for the mental, emotional, and spiritual health of patients is so important. So she's already identified she's encouraged patients to do Over the Edge this year. But Kelly's always engaged in the Victory Center events and our other community partners. So she walks the walk, not just talks the talk.
And I do think too, one of the big things for the support groups is the caregiver support group, because to be a spouse, whatever type of family member, friend, watching somebody get a head and neck cancer and go through treatment, it's traumatic. So I always, it's wonderful to say, not only for you, but caregivers. I know I tell people about your massage therapy, Reiki therapy, heard somebody talk not that long ago about the art classes. So I really encourage people, hey, just call and get on the roster, and then they'll send you stuff out. If you're not ready, just at least get your name on the roster, and they'll send stuff to you, and you'll see, maybe then something's going to, they might not feel like it through treatment, but maybe even after treatment.
Yeah. And I think, Kelly, you had said earlier, timing is everything. And that's true for us here at the Victory Center as well. We wait for them to be ready, and when they are, we're here. Thank you, ladies, so much for joining me today. It is National Head and Neck Cancer Awareness Month. So I'm happy to share this topic with more folks and help them learn.
Thanks.
Thank you, Kimberly.